Our topic for today is all about the skeletal system. So let's start with the five functions of our skeletal system. So let's have your movement. So the skeletal muscles are attached to our bones. Therefore, when the associated muscles contract, they cause bones to move. Another is support. So the skeleton is the framework of the body. So it supports the softer tissues and provides points of attachment for most skeletal muscles. Another one is for protection. So the skeleton provides mechanical protection for many of the body's internal organs, reducing now risk of injury to them. So a good example, we have your cranial bones, which now protects your brain, your rib cage, which now protects your lungs and your heart, the vertebrae, which now protects your spinal cord. Another is the production of blood cells. So the red and white blood cells are formed by tissue called your marrow, which is in the center of the bone. So the red blood cell formed in the red bone marrow of the bone stem cells called now your hemocytoblast. Okay, hemocytoblast. So they give rise to all the formed elements in blood, which it takes about 2 days to form red blood cells. And the last one is storage. They store minerals like your calcium and your phosphorus. So when required, bone releases minerals into the blood, facilitating now the balance of minerals in the body. So these are the five functions of your skeletal system. So we also have here different types of skeleton. So the first one is the liquid skeleton, since it's just made up of, they are filled with water. They do not really have what we call now the real bones. Examples of this are your jellyfish, amoeba, and earthworm. So their soft body is really filled with water. But how do jellyfish move? So they have the tentacles. It opens and closes its umbrella, so it propels itself, therefore producing now movement. Another one, how about the earthworm? So the earthworm, their muscles squeeze against the liquid in order for them to move. So the earthworm, they are filled with liquid trapped in its spaces inside their body. That is how do they move. Another one type of skeleton is your exoskeleton, which is their bones or skeleton is located outside their body. All arthropods have exoskeleton. Like for example, we have their insects, spiders, and crabs. But what makes their covering very hard, their shell or its covering? These covering are made up of chitin. These are form of polysaccharides. These are actually complex carbohydrates. So they protect now the soft parts inside the skeleton. So we have here the structure of the chitin monomer, and look at now the picture B. So the covering cannot grow as the rest of the body does. So often, the hard covering is shed and a new one grows, and this is what we call now molting. And then, kung nakapapansin ninyo or yung ginagamit nila during surgical operations sa hospitals, those are made of, their surgical threads are made actually of chitin. Ganyan ka-flexible at katigas or ka-strong ang mga chitin. So that's why very hard ang covering ng mga arthropods or mga exoskeleton animals. Another one is your endoskeleton, which are actually their skeleton is inside their body. So it is made up of hard bones and cartilages. So the internal skeleton provides strong framework for muscles and means that it can grow with the body. So like for example, we have your fish, reptiles, birds, and mammals like your human beings. Okay, so let's go to the bone shapes. So there are five shapes of our bones in the body. So we have here your long bones. So these are relatively long and slender. They can be located or examples of your long bones in your body are your arms, forearm, thigh and legs, palms, soles, fingers, and toes. Actually, the long bones, these are the really, it helps really in the production of your blood cells. Another one is your short bones. So the short bones, these are actually small and boxy. Pag sinabi mong boxy, these are shaped like a cube or rectangular box. A good examples of short bones in your body, we have your wrist and your ankles. Another shape are your flat bones. So these are thin, roughly parallel surfaces, and they can be found, or these are examples. We have the roof of your skull, your sternum, ribs, and your scapula. And then the fourth shape is your irregular bones. So they have, since they are irregular, they really have complex shapes with short, flat, notch, or rigid surfaces. Pag notch kasi, pag sinabi mong notch, it's actually V-shaped cut. These are examples. We have your vertebrae, pelvis, and some facial bones. Okay, and then the last is your sesamoid bones. So these are generally small, flat and shaped somewhat like a sesame seed. Ganon sila kaliit. Okay, so they can be likened to the shape of your sesame seed. So the common location of this are near your joints, at your knees, or in your patella. Okay, and then the sixth pala is we have your sutural bones or the wormian bones. So these are small, flat, irregularly shaped bones between the flat bones of your skull. So dito sila matatagpuan in your skull. These are what we call your sutural bones. So these are borders or like their borders are like pieces of puzzle. Yeah. Okay, so this is now the bone structure. Okay, so let's discuss the bone structure. We have here your spongy bone. Spongy bone is sponge. Okay, ayan. This is actually, okay, this is actually your spongy bone or these are cancellous bones. These form struts and plates called your trabeculae. Ito yung trabeculae na tinatawag natin, yung parang ito may mga butas-butas siya. Trabeculae. Yan. Okay. And then this is the compact bone. Compact na kunana, okay? Pag compact, kumbaga, these are hard, okay? These are dense bone, mass of tiny arranged in concentric layers, which is now your tinatawag nating Haversian system. Okay, Haversian system. So, in your compact bone, meron tayong makikita dito. This is the structure of your compact bone. In that compact bone, meron kayong makikita dito na tinatawag nating osteon. So, what are these osteon? These are actually the basic functional unit of mature compact bone. Then, this is the narrow cavity. Okay? Ito. Narrow cavity. And then, this is the yellow bone marrow. Usually, sabi ko nga kanina, this is an example of your long bone. So, dito na makikita usually yung production ng ating mga blood cells. Okay. And then, we also have here your periosteum. Periosteum is actually this is actually a fibrous membrane that surrounds the outside of your bones, except your diaphysis. Andito yung ating diaphysis. This is the diaphysis, okay? This is the diaphysis, or the tinatawag nating shaft. Except pala ng ating tinatawag na epiphysis. Yung epiphysis, eto kasi dito matatagpuan sa sponge bone natin. Okay? Dito ang sa epiphysis natin. Yan. Yung kwan natin, this is now the diaphysis or the shaft. This is eto. And eto is the metaphysis. Andito siya. And then epiphysis. Sa dulo-dulo niya, epiphysis. And on this part, meron ka kasing tatawagin dito na sa pinakadulo naman niya dito, okay, dito yung tinatawag nating articular cartilage. Okay, nandito rin sa baba, meron din silang tinatawag na articular cartilage. So, these are thin layer of hyaline. Anong ginagawa nila? Since these are thin layer of hyaline, so they reduces hyaline cartilage. So, ang ginagawa nila, they reduces friction, okay, and absorbs shock at freely movable joints. Kaya very free mag-move ang ating mga bones. Why? Because of the articular cartilages na yan. So, para magre-reduce lang siya ng friction once there is movable, once you move. Okay, once there is the movement. And this is the marrow cavity at the center of it. This is the marrow cavity. So these are a layer of compact bone that surrounds a central space. So they contain, as I have said a while back, they contain your bone marrow or yung tinatawag nating loose connective tissue. So there are two types of this cavity or ating mga bone marrows. So this one, this is an example of your yellow bone marrow. So these are being dominated by fat cells. So these are, what is the importance of this? They are important energy reserve. Another type of marrow is what we call now your red bone marrow. So it's really a mixture of mature and immature red blood cells, white blood cells, and stem cells that produce them. So para saan ito? It's really an important site of blood cell formation. Yan. Okay? So those are the types of your marrow. Yan. Okay. So this is the bone structure. Next, let's go to the human skeleton. So very important ang human skeleton natin, especially in protecting now our internal organs. And aside from that, they also give us a structure or shape. Okay? So your skeleton is actually divided into two. We have here what you call, the first one is what we call your axial skeleton. Okay, so your axial skeleton is actually composed of your skull, the spine, your spinal column, okay, your vertebrae, rib cage, and your sternum. So it consists actually of 80 bones. So in your skull, we have here 8 bones, okay, 8 cranial bones, and 14 facial bones. And then, what are the bones associated with skull? We have here your 6 auditory ossicles and 1 hyoid. And then the thoracic cage, which composed of 1 sternum and 24 ribs. And your spinal column, it has 24 vertebrae, 1 sacrum, and 1 coccyx. So, making now your axial skeleton. So, all in all, you have 80 bones in your axial skeleton. So what are the functions of your axial skeleton? So they are what? They adjust the positions of the head, neck, and trunk. So very important sila, especially when your head, your neck, and trunk, if there is a movement of it. So they allow respiratory movements, kaya very flexible ang ating axial skeleton. They stabilize or position parts of the appendicular skeleton. So this is appendicular skeleton is another type of your axial skeleton, another division of your skeleton. So yung mga appendages, yung mga nakakabit sa katawan natin, like for example, yung mga arms and your feet natin. So the next division of the skeleton is what we call now your appendicular skeleton. So it consists of 126 bones. So appendages of the arm, we have your arms, shoulders, hips, and your legs. So let's discuss them one by one. So let's start with the skull. So by just looking at the skull, you can see there a lot of bones, diba? You can see there a lot of bones in your skull. So the very first function of the primary function of your skull is really for the protection of your brain. So it consists of 22 bones plus your 7 associated bones. So, okay, so andito lahat ng mga pangalan ng ating mga bones. So just study the picture and you'll see the different names of the bone. So we have here like the movable part of your jaw is what we call the mandible. Ito naman is the immovable jaw is what we call your maxillary bone. Yung kwan naman natin, yung cheekbones natin, they are known as your zygomatic bone. And then, ano pa ba yung important dito? This one, it's the bone that is located in your, tawag dito, in your forehead. This is what we call your frontal bone. And then the uppermost part of your skull is, or the uppermost part of your bone, of your head is the parietal bone. Yan. At kung may makikita kayong mga may butas-butas na yan, these are all called as your foramen. This is in this part, you have your mental foramen, and then on dito sa taas, this is what we call your supraorbital foramen. Yan. Okay. So, these are all the bones in your skull. So, eto, kung nakikita ninyo, yung mga linings dito, these are all the sutures na sinasabi ko kanina. These are like the jigsaw puzzle. Yan, mga lines or sutures, or yes, sutures in your skull. Eto, you can name this one as the coronal suture. Okay, so yan. So, we have here the 4 major sutures. Ito na yung sinasabi ko. Tingnan ninyo, yung mga edges nila, it could be likened to a jigsaw puzzle. So, the first one, we have your lambdoid suture. So, the lambdoid suture, it separates now your occipital bones from the 2 parietal bones. Ayan. Next, okay, so andito. And this is the lambdoid suture. Next is the coronal suture, which attaches the frontal bone to the parietal bones of either side. So, andito yung coronal bones or sutures natin. And then the sagittal suture, it extends from the lambdoid suture to the coronal suture between the parietal bones. Okay, so eto, nandun sa middle of the center, the midline of the skull. And then the squamous suture, it's located boundary between the temporal bone and the parietal bone. So this is the squamous suture. And dito siya sa side, it's somewhat like in your ears. Okay. So those are the 4 major types of sutures in your skull. So, as you can see, the structure of the skull of infants or children is so different when in terms of to the structure of the skull of the adults. Okay, so at birth, the cranial bones are connected by areas of fibrous connective tissue which is known as the fontanelles. So this fontanelle in the skull, it permits the skull to distort without damage during delivery. Okay, helping to ease the child through birth canal. So eto, very soft siya. Okay, yung fontanelle na yan. Kumbaga, hindi pa, kung sa mga infants, fontanelles ang tawag sa kanila, yung mga linya-linya na yan, these are all fontanelles. Pero once they become an adult, ang tawag na sa kanila ay magiging sutures na. Okay? So, yan. So, there are 4 major fontanelles for the infants or children. They have the anterior occipital sphenoid fontanelle and the mastoid fontanelle. So, yung pan natin, your anterior is really the soft part dito. Yung soft part talaga na ito yung pinagbabawal ng hawakan, yung very, very, very sa mga infants. So only fontanelle easily seen by parents. Why? Because it is just composed of fibrous connective tissue and it covers a major blood vessel. So nakikita mo talaga yung pulse, okay? Pulse as the heart beats. Nakikita yung very soft dito sa ulo ng infant. Yun yung anterior fontanelle. Kaya nga nakikita ninyo pag nagkakaroon ng pulse or nagbibit yung heart natin, makikita mo yung pulso dito sa anterior fontanelle. So generally, it persists until the child is nearly 2 years old. Nawawala yan until 2 years old. Yung occipital naman is and your sphenoid and your mastoid fontanelle, it disappear within a month or 2 months after birth. Kaya mabilis lang sila. Okay, mabilis lang silang kumbaga mag-develop. Pero ang anterior, ito yung matagal. Usually it takes 2 years to develop. Yan. So, okay. By the way, what is the difference of the skull of children and adults are so different in terms of size? Okay, in terms of size, shape, and suture. So the most significant growth in the skull, of course, before age 5, because at the time the brain is stopped growing and cranial sutures develop. Doon pa lang, yun na yung pagkakaiba ng mga skull ng mga infants or children and to that adult. Okay? Kumbaga nagde-develop na sila ng cranial sutures once their brain is stop growing, and that will happen before the age of 5. Kaya nga, pag sa age of 5 na, ang tigas-tigas na ng ulo ng mga bata. Okay? Kasi nag-fully develop na, hindi natawag sa kanila fontanelles, but these are already sutures. Ayan. So, kailan nagkakaroon ng sutures ng mga bata? Usually, before age 5. Okay. So, next, we have here the vertebral column. Okay. So, the vertebral column is the one that protects the spinal cord and help maintain the upright body position of a human body. So, it consists of 26 bones. We have here your 24 vertebrae, 1 sacrum, and 1 coccyx tailbone. Okay, so, and dito, this is the tailbone na tinatawag natin or yung duri. Okay, or yung duri. So, going back to this structure, the letter A, the green part, there are names of this vertebral column. So, eto yung letter A, the green vertebrae, these are called your cervical vertebrae. We have 7 here, 7 bones in your cervical vertebrae. And kung makikita ninyo yung F and G dito, yung F, ito yung usually tinatawag natin C1 and C2. Yung G is the C2. F is the C1. So C1, or somewhat like we call it as Atlas, okay, they are being named after Atlas according to Greek myth, which holds the world on its shoulder. Kasi bakit ano kaya? Kasi ang function ng C1 na yan, or the Atlas, it's the articulation permits you to say, you to nod, yes. Okay, yung tawag dito, up-down movement of your head, it's because of the articulation of your C1 or the Atlas. Yung C2 naman is the axis. Okay, yung letter G dito, this is the axis. It permits rotation of the no. Okay, from right to left or left to right, yun yung kanyang movement, yung letter G. Okay, so comprising now your cervical vertebrae, it composed of 7 bones. Next, the letter B naman, this is named as your thoracic vertebrae, which composed of 12 bones. Yeah. So usually dito, they protect your what? They protect your lungs and your heart. And then the letter C naman, these are the lumbar vertebrae, which compose of 5 bones. So dito, ang usually nasasaktan dito is the letter C, the lumbar bones, because it bears the most weight. Kaya masakit ang likod ninyo kung maghapon kayong nakaupo. Yan, dito yung masakit. Okay, lahat ng weight ninyo, siya yung tawag dito, mangsarsarapa kumain. And then your sacrum, the letter on this part. So actually, yung sacrum natin, these are fused components of 5 sacral vertebrae. So, kailan siya nag-fuse? Completely at the age of 25 to 30. Okay? 20, actually, pag below 24, below 25 pa lang yung age mo, usually very visible yung 5 bones dito. Pero at once you reach 25 to 30, okay, dito na, it completely fuse. Kaya isa na lang yung makikita mo dito as bone. Yes. Kaya nga, magtataka kayo, okay, magtaka kayo na we're in 208 ang bones ng adult. Ang infants or ang children, they have 306 bones. Kasi hindi pa fully developed or hindi pa nag-fuse yung ibang bones, kaya mas marami silang bones. But once they reaches now your 25 to 30 or pataas, nagkakaroon na sila ng 208 bones. Fully developed na yung kanilang mga bones. Next, we have your ribs. Okay? The ribs is also known as your costae. They are elongated, curved, flattened bones that originate on or between the thoracic vertebrae and end in the wall of the thoracic cavity. So these are all. These are your ribs, and there are 3 types of ribs. We have what we call your true ribs. So these true ribs are also known as your vertebrosternal ribs. Why is it? The first 7 pairs are considered to be the true ribs. Why they are named like that? Because they are really joined directly to the sternum. Yan. They are attached to that sternum. That's why they are being called as the true ribs. And then the other one is what we call now the false ribs. 3 pairs, okay? The 3 pairs after the first 7 pairs, these are now your false ribs. Why? Because they do not directly attach to your sternum. Saan sila naka-attach? They are being attached to the cartilage of the true ribs. Kaya sila tinawag na false ribs. Okay, they are joined to the sternum by cartilage. They are not really attached to the sternum, and this is the sternum. And then the last one, we have your floating ribs. The last 2 pairs, the 11th and 12th pairs of your ribs. These are what we call floating ribs. Eto, andito sila. Why? They are just floating. They do not attach. They are not connected to the sternum. They are not connected to that cartilage. That's why they are known as the floating ribs. Yeah. What's the function of the ribs? Of course, for the protection of the important internal organs in our body, like your heart, your lungs, and so on and so on. Okay. So we have here the sternum. This is the sternum. Okay. So this sternum is also known as the breastbone. So there are 3 components of the sternum. We have your manubrium, the body. This is the manubrium. Ito yung visible part sa mga payat. Okay, parang yung dito na parang prominent sila. Okay, katabi lang siya ng inyong clavicle or your shoulder bones or your collarbone. Yan. And then, ito yung body niya. And then dito, susok dito, this is the xiphoid process. Yan. Xiphoid process, parang kasla dito, ayan, tirusok tayo. So these are the parts of your sternum or the breastbone. The clavicle, ayan. This is the clavicle. It's S-shaped bones that originated the superior border of the manubrium, which is known, the clavicle is also known as your collarbone. Ayan, to quell yung t-shirt tayo or body tayo. That's why they are known as the clavicle. And they permit our movement. And then the scapulae or the scapula, okay, ito yung wings naman natin sa likod. It consists of superior angle, inferior angle, and your lateral angle. So yan, parang yung wings ang itsura nila, yung scapula. So another is the humerus. This is the bone in your upper arm. Mag-isa lang niya. Okay, the humerus, this is the upper arm bone. Okay, yan, the humerus. And then, on your lower arm, we have two bones here. We have the radius and the ulna. Okay? Remember your anatomical position. Okay? The one that I discussed to you. So, palms forward. So, kaya ganyan yung itsura ng kamay nila dyan. So, the one that is on the inner part, okay, inner part of the bone, inner part of your inner bone in your lower arm, it's your ulna. And then the outer bone is your radius. Yeah. Radius on top, ulna on bottom. Okay. So carpals, or they are known as your wrist bones. Wrist bones. So there are four proximal carpal bones. They have the what we call now yung scaphoid, lunate, triquetrum, and the pisiform. Yung four distal carpal bones naman natin, we have here the trapezium, trapezoid, capitate, and hamate bone. Yan. So these are all, this is, this is your proximal, or these are your carpal, or the wrist bones. Okay, so this one is an abbreviation to it for you to memorize the bones in your carpal bones. S, some likes to push the toy car hard. So S, scaphoid. L, lunate. Yan. Okay, so yeah. Next is the metacarpals. These are the bones in your palm. Yan. Metacarpals, the bones in your palm. And then the phalanges, these are your fingers, the little fingers that you have. These are known as your phalanges. Then in this one, the pelvis is known as the dancing bone. Okay, so the dancing bone. So in that pelvis, yan, actually this is composed. It has three fusion bones. We have here the ischium, the pubis, and the ilium. So, what's the difference between the pelvis of the female and the male? So, in terms of shape, okay? What is the difference? So, for female, for female, their pelvis is generally smoother, lighter, and it has less prominent markings. Yeah. But when you compare it to the male, to look at now the angle, mas malawak or mas maluwang ang angle for the female, 100% or more. Why? Because it's for the function of what? For childbearing. Ang male lang is just 90 or less. Okay, so yan. So, ano pa ang nakikita ninyo? Enlarged pelvic outlet. Yan, dito. Look at now this one. It has a wider, more circular pelvic outlet. Very circular siya and wider. Ito is narrow. Okay? It's narrow. Dito pa, we have low pelvis. Ito mataas yung kanya, ang pelvis niya. Ang low pelvis naman ang sa mga babae. Why? Okay, to somewhat like give a space for the baby or for the fetus. Yan. So, it supports the weight of the developing fetus and passageway of the newborn during delivery. Yun yung pinaka-importance ng pelvis, especially sa mga female. Kung hindi maganda yung shape or size ng mga pelvis ng mga female, then eto, nagkakaroon talaga sila. They will never undergo the process of normal delivery pag nanganak sila. Kaya more on cesarean section or CS. Okay. Next, the femur is the largest bone in our body. Dito talaga yung take good deal of your femur kasi dito talaga nanggagaling mostly yung production ng ating blood cells. at napakamahal when na-damage ang femur ninyo. Okay, the patella, which is somewhat like a sesamoid bone, ganito ang itsura nila. It's your knee bone, okay? It's your knee bone. It is cartilaginous at birth, but at the age of 2 or 3, nag-oossify na siya. Kumbaga, it is turning into what? It's turning into real bones. Cartilage pa lang sila, soft bones pa lang sila at birth. Kaya nga, hindi talaga pwedeng pwersahin yung mga bata or infants to walk, okay, or gutad-guta din because their bones are really made from cartilage muna. So, kailan lang usually nag-oossify or nagde-develop as into true bones ang mga bones ng mga bata. Yan, that is for your patella. Okay. And then ito is the lower leg. There are two again. There are two bones in your lower leg. The bigger one is the larger one is what we call your tibia, or sometimes we call it a shin bone. Why? Kasi I research on this. Pag kasi naibumpar mo dito shin bone, dito tibia or shin bone, mapapasyet ka daw. Parang mapapamura ka or mga ganun ka. That's a sobrang sakit. Okay? That's the tibia or the shin bone. It's a large medial bone of your leg. Usually, it bears weight from the femur. Yeah. And then the smaller bone, this is the fibula. Okay? The fibula. So, it does not help transfer weight to the ankle and foot. So, it does not even articulate with the femur. Kaya kung gumalaw ang upper leg mo, there's no movement of it. So, it's just only a site of attachment of what? Muscles that move the feet and your toes. So, yan lang. Attachment of muscles lang ang ating fibula. Ayan. Next, we have your tarsals or your ankle. Okay, ankle. So, it composed of 7 bones dito, yung sa tarsals ninyo. So, we have here, wait lang, okay. So, we have here your talus. This one, the talus, ito yung masakit usually, especially pag naka-high heels ka. So, the one that transmits weight of the body from the tibia toward the toes. And calcaneus dito sa likod, this is the heel bone, okay? Your heel bone, or sometimes you call it as your calcaneus. This is the largest tarsal bone. When you stand normally, most of your weight is transmitted from the tibia, okay, from the large lower leg, lower bone, to your talus, to the calcaneus, and then to the ground. Ganun yung delivery or yung tawag dito, yung transmission ng weight. So, mag-start ng tibia, going to talus, going to calcaneus, and to the ground. So, we have here your Achilles bone or tendon. Ito, this is the Achilles tendon. This is so strong. Okay, it can lift the heel of the ground so that you can stand on your tiptoes. Very strong or very, especially ito, very strong, or they have a special calcaneus bone or tawag dito, Achilles tendon ang mga ballet dancers. That's why they can tiptoe for so long. Yan. They have a special Achilles tendon. Yan. And then the metatarsals, these are the bones in your feet, in your foot. There are five bones here in your metatarsals. Like the metacarpals, they are also being identified by Roman numerals. Okay? So, yung makikita nyo din kanina na meron siyang 1, 2, 3, 4, 5. So, okay. So, yung hallux. Ang hallux is the great toe. And then the phalanges. Yan. These are the fingers. There are 14 bones in the phalanges. Hallux has 2 or the rest, tatlo. Okay? Tatlo. Yung little finger, and then yung hallux lang or yung big toe natin, siya lang yung may 2 bones dito. And then the rest, they have 3 bones. Okay. And then the last one is the joints. So joints is also very important in the structure, in our skeleton. Okay, so these are sites where two bones or cartilages meet. So it allows movement of the bone to take place. If they are being covered with smooth cartilage to reduce friction between them. Kaya nga, when you move, you do not feel any pain, any heat, okay? Because there are somewhat like cartilages that reducing now the friction that will now produce between two bones. They are held together by your ligaments. They are strong, stretchable strands of your connective tissue. So there are types of joint: the synarthrosis, diarthrosis, and amphiarthrosis. So this is the types of joint are based on the movement, amount of movement of the joints. So when you say synarthrosis, these are immovable joints. Okay, examples: the sutures. Okay, as I had said, some of the structure are like the puzzle or the puzzle. Okay, the puzzle. So these lines of junction of your skull bones, these are synarthrosis. This cannot be moved. Okay, yan, ito. And then we have the four sutures. Gum poses. Ayan. Gum poses, these are also example of your synarthrosis. They bind the tissue bony sockets in the maxillary and the mandible bones. And then the second one is the amphiarthrosis, which there is a little movement of our joints. So they have no joint cavity. Examples, okay, so examples are your vertebrae, okay, in your spinal column. What else? They are located in this one in ribs and your breastbone. Kaya nga, very limited lang yung expansion ng lungs natin. Why? Because limited lang din ang expansion or movement ng ating rib cage and the breastbone. And then diarthrosis, eto, synovial joints, these are known as your synovial joints or freely movable joints. Okay, so talagang you can see the range of the movement of these joints. So there are types of it. Ball and socket joints, somewhat like they can be found in your shoulders or your hips. The hinge joints, okay, in your elbow and in your knee. The okay, junction of atlas and axis. Saan natin matatagpuan yung atlas and axis? These are your cervical axis, cervical vertebrae, the C1 and the C2. And then gliding, dito natin matatagpo. Examples of it are your carpals and your intertarsal complex. Ayan. Okay? So, those are the joints of the body. So, if you have a question, please feel free to chat me or to send a message for your query. Thank you.